There are primarily three considerations when allocating a mental health phase of care: the characteristics of the consumer, the primary goal of care, and your clinical decisions regarding the intensity and duration of your contact with that consumer. The mental health phase of care is completed following a comprehensive biopsychosocial assessment. This gives you an understanding of the consumer's characteristics. This then informs your care plan, which reflects your, in part, primary goal of care. That care plan should also provide a description of the intensity and the duration of contact you expect with this individual consumer. The mental health phase of care then asks you to allocate the consumer to one of 5 categories. Assessment only is the gathering of information to enable the referral of the consumer to the most appropriate services to meet their needs. Acute is the short-term reduction of psychiatric symptomatology. An intense intervention with an expectation that the consumer will change within the days to weeks. This is in contrast to functional gain, where the primary goal of care is improvements in psychosocial functioning. The intensity of intervention is lower, but with the expectation that the duration of contact is longer, weeks to months. This is in contrast to intensive extended, where a consumer has high levels of psychiatric symptomatology, poor levels of psychosocial functioning, and the expectation is that services will be required to have contact with that consumer on an ongoing basis, months to years, with intensive input to improve functioning or decrease psychiatric symptomatology or prevent relapse in that individual consumer. This is in contrast to an individual who has reached a balance. Their level of psychosocial functioning and their level of psychiatric symptomatology have reached a plateau, but they require the ongoing contact of mental health services to maintain that balance.